The Central Valley is very huge. It's the heart of California.
The community that we serve here is very diverse. We get a lot of migrant populations, and there's many different languages.
We have a lot of essential workers here, especially the farm worker community, working day in and day out from, dawn to dusk to feed our country, really.
We're the breadbasket, not just of the state, but of much of the world. Yet most of our patients live below poverty, don't have access to physicians.
There are so many communities here who need help, as simple as just going to a doctor for a preventative care, and UCSF Fresno's presence in the Central Valley is so critical.
The mission at UCSF Fresno is essentially to be able to train world-class health providers that want to remain here so that they can serve this population that, as it stands currently, does not have great health outcomes.
We were started 50 years ago because of the physician shortage, right? There was a call to grow doctors in the valley for the valley. We train the doctors in all the specialties from medical school up and beyond into becoming your subspecialist acute care surgeon. We've been very successful in that as the largest program here in the San Joaquin region, because the two biggest predictors for where you're going to practice is where you train and where you're from.
I'm the daughter of two Mexican immigrants. I initially grew up here in Fresno. Both my grandparents, they played a big role in taking care of me ever since I was little. And my grandfather, he had a lot of medical conditions, one of them being like heart failure. That really helped shape my medical experiences. One of the best aspects, I think, of the UCSF Fresno SJV Prime program is returning to your community and being trained by physicians that are also familiar with your community. And I always saw myself being that kind of provider, being able to relate with my patients and speak to them in their native language to really give them the best care.
The San Joaquin Valley in California is home to one of the largest Hmong community in the entire country, and Fresno is at the heart of this community. My journey into medicine began when we arrived here in the United States as the last part of the Hmong refugees from Thailand. My dad, unfortunately, when we arrived, fell really ill. Being the first person in the family to be able to speak English, I received the significant responsibility of becoming my dad's caretaker. It really allowed me to become more exposed to and witness all of the disparities that were affecting not only me, my family, but my community. SJV Prime was the perfect program for me. To me, it's just more than a program. It's a homecoming.
Moving forward, it's important to continue to build the physician workforces here and really to see the value in each person, each medical student, each resident, and each patient.
I'm very, very grateful for SJV Prime, and I want to continue its legacy of serving those who need it most.
We're now bringing research trials, cutting-edge technologies, all the things that are happening at UCSF are now coming down to the region. And that really moves the needle for healthcare.
These programs will augment not just in numbers, but of course in the quality of the type of healthcare that the communities absolutely deserve.
I plan on expanding those programs and building it out so that we can actually address healthcare disparities throughout the entire region with a much larger class and a much larger graduate medical education program. That's what I hope for the future of UCSF Fresno in the next 50 years.
We are family.
We are the Valley.
We are 50 years strong.
We are UCSF Fresno.